I am Professor Dr. Vivek Gupta. I am Senior Interventional Cardiologist associated with Indraprastha Apollo Hospital, New Delhi. Before that, I was working with Professor Alain Cribier in France. And I belong to New Delhi now, but before in Lucknow. So this is my privilege and pleasure to speak on CSI TV on 18th of June 2022, especially about my talk, which was just now I finished my talk in the National Intervention Council meeting in CSI in Ahmedabad. The topic of my talk was transcatheter aortic valve implantation, which is TAVI, bench side to bedside. That means how it evolved. Since I had the privilege of working with Professor Alain Cribier, who is the father of TAVI, Americans call it TAVR. They say transcatheter aortic valve replacement, but actually it is implantation, not the replacement, because you're not taking out the native valve. So replacement is when you take out the native valve and put another valve. So it is actually TAVI. So I had the privilege of working with Professor Alain Cribier, who did the first valve implantation April 16, 2002, exactly 20 years back. This TAVR procedure or TAVI procedure is now 20-year-old, although in India it is not being done still so much for so many reasons. This TAVI technique, to make the people understand, is actually non-surgical aortic valve implantation in the patient of severe calcific aortic valve stenosis. Severe calcific aortic valve stenosis. I want to tell to the public, because there are a lot of public also listen and physicians, that there are 4 valves inside the heart, and the most important valves are mitral valve and aortic valve. The aortic valve is very, very important because this is the main outflow tract from the heart which supplies the blood to the whole body. When this valve gets stenosed, then slowly the heart fails, ejection fraction goes down, and also these patients go into cardiogenic shock and they die. Once diagnosed, I repeat, once diagnosed, severe aortic valve stenosis, the lifespan is limited. The only way is you either relieve the stenosis or put another valve. Relieving the stenosis by balloon was first done by Professor Alain Cribier in 1985, and that was balloon aortic valvuloplasty. 1985, almost 30 years back. So at that time, the aortic valve dilatation by the balloon was considered to be very, very risky, and he was the first one to do it, a heroic procedure, and he became celebrity overnight. This was published in Lancet Journal in 1986. From then onwards, he had a severe passion and rather obsession to develop something non-surgically where aortic valve can be replaced or implanted without opening the chest. The reason, the patient who has a severe aortic valve stenosis, if they are a comorbidity or heart failure or post-bypass, are normally elderly people. And surgical aortic valve replacement by opening the chest and opening the heart, the open heart surgery, is having a high risk of 2 to 10%. And many surgeons do not take the procedure and finally the patient dies. So this transcatheter aortic valve implantation has saved thousands or rather millions of lives. Till now, it is now being done in 70 countries. I said the first one was done in 2002. It is being done in 70 countries, and more than 15 lakh patients have been treated by this technique. 15 lakh patients have been treated by this technique. A small story I would like to tell you. When this Dr. Alain Cribier was finding a sponsor in 1994 to 1999, most of the companies, including Edward, which is selling this valve now as a hotcake, and Medtronic, which is also selling this valve as a hotcake, they rejected the hypothesis. Dr. Cribier approached these 2 companies and they said, just forget it. It is the most foolish idea ever thought. But he was not, at that time, he was quite disappointed. He made his own company by the name of PVT, Percutaneous Valve Technology, with Israeli friend and also with Martin Leon, who is a very senior and very celebrity cardiologist from America. And this company then engineered the valve in Israel from the sheep pericardium and they started doing animal experimentation. And the first case was done by PVT company in 2002. And to just listen to this story, very important, the same Edward company which had rejected the idea completely, don't ever bring this project to us. This is what they said to Dr. Alan Crebier. They finally bought the company PVT. And now the valve which was known as Crebier-Edward valve was then taken away. The valve was then known as Crebier-Edward valve, and now Edward-Sapien valve. Now it is Sapien valve. So the evolution of the valve is very interesting. You have to have passion, you have to have obsession to do something new. If it was not Dr. Alan Crebier, the valve would not have been there, and we would not have been talking about this TAVI. And you can see in the exhibition of CSI, there are more than 5-7 companies who are trying to sell it in different way. To tell you a small more thing, this TAVI technique, transcatheter aortic valve implantation, is normally done from the groin, the femoral artery. It is a procedure something like stent, where you put a stent in the coronary artery. Everybody knows about stenting, angioplasty stenting. The valve is taken from the femoral artery, it goes into the descending aorta, then ascending aorta, then aortic valve, and then after proper positioning, it's very important, because the coronary arteries are arising just above the valve. If you put a valve in the wrong position, the patient will die on the table. So after my talk, somebody was talking about the complications. The complications do not happen if you are very well versed with the technique. I have not seen a single complication with Professor Alan Crebier. I was the first person to do the first aortic valve implantation of India, but not in India, but in France. November 2011, we treated, at that time the valve was not available in India. I'm talking 2011. The valve was not available in India, Edward, neither Medtronic. So we took the patient, and the patient flew to Rouen, Hospital Charles Nicolle in France, where Dr. Alan Crebier is working, where I was working as a fellow 1996 to 1998. We took the patient in 2011, and the patient, I was scrubbed with the patient, 40 minutes procedure, patient was discharged third day, patient lived for another 10 years. He died recently, the man, because of the kidney failure and other problems, not because of the valve. So transcatheter aortic valve implantation, hats off to Professor Alan Crebier, has now a very important life-saving procedure. Although it is a little more expensive, I was talking to companies to cut down the price, then it will be more easily. It was earlier only for the high-risk patient. Now with the PARTNER 3 trial, it has been proven that this is better than surgical aortic valve replacement, or almost equivalent, even in low-risk patient. That means any patient coming at the age of 60 with aortic valve stenosis, patient does not have a high-risk factor, he does not have previous bypass surgery, his left ventricle functions are normal. Even then, TAVI is now established. To finalize and summarize, in 2002, TAVI was indicated in 2002 when surgical aortic valve replacement was not feasible. I repeat, in 2002, TAVI was indicated when surgical aortic valve replacement was not feasible because of high risk. In 2022, surgical aortic valve replacement is indicated when TAVI is not possible to do. It's just the reverse. In 2002, I repeat, it's very important. TAVI was indicated when surgical aortic valve replacement was not possible or feasible. In 2022, surgical aortic valve replacement is indicated when TAVI is not feasible for some reasons or the other. Thank you very much. Professor Dr. Vivek Gupta from Senior Cardiologist from Apollo Hospital, New Delhi, on CSI TV on 18th of June 2022 in Ahmedabad in Club 07. Thank you.